Welcome and thank you for joining us for our Muscles Matter TriLift webinar with Sarah Hudson. I'm Jess Sluger, I'm one of the Business Development Managers for Lumenis ANZ, and tonight I'm joined by our wonderful TriLift partner, Sarah Hudson. Sarah is an aesthetic practitioner for over 25 years and she has provided aesthetic skin services to valued clients. She's been a leader in the aesthetic skin therapy industry as well. She's frequently invited to share her knowledge at industry events, work groups, seminars and panels, and Sarah is renowned for her expertise in the field of RF skin needling, IPL, medical grade laser, LED light therapy, and has been featured across industry and consumer media from print to television. Sarah is also a key opinion leader for TriLift, and we're thrilled that she has joined us this evening to talk about the importance of facial muscles for successful facial rejuvenation. Tonight, Sarah will share her personal experience with TriLift, including why muscle stimulation is so important, a relative game changer for the aesthetic market, how she integrated the device into her clinic. She'll also be discussing her combination approach, patient feedback, and most importantly, the results that she has achieved to date. Before I hand it over to Sarah, I wanted to advise that all attendees' microphones have been muted. However, you can ask questions via the question panel on your screen throughout the presentation, and we will cover these questions at the end of the presentation. I'll now hand the presentation over to Sarah. Welcome. Sarah, you are muted. I will let you know.
Hi everyone, I'm so excited to share my knowledge and passion tonight about TriLift and to really just share with you what a great device it is, not only from a business point of view, but also from a practitioner point of view as well. One of the reasons why I absolutely love this technology is because it blends 3 different technologies into one, which is the dynamic muscle stimulation for facial structure, the RF technology for wrinkles and also giving the skin this really beautiful luminous look, and also the RF skin needling, which we have seen as a real game changer within the clinic on smoothing out the skin and really bringing a lovely noticeable difference to the skin as well. One of the other aspects that I love about TriLift is that we've been able to use it in the clinic with our other devices. So from a multi-purpose point of view, we have used it with some of our Cutera devices, we use it with peels, and so it actually complements the other services that we provide. Plus, as well as that, it also allows us to extend our service offering as well. My clinic is really based around skin health without the need for injectables. So I have a doctor that I work with, Dr. Jack Samaras. He's a plastic surgeon. He comes into our clinic about every 6 weeks, and he does injectables within the clinic. But we do have a very small injectable market, and we have really seen for us and our clients, they really want to take a holistic alternative approach to injectables. So introducing TriLift was a really great technology that we could use to bring that really beautiful skin health. And when you see some of the results that we have achieved over the last 12 months, that's really what we're about, is having a change to the aspect of the skin. So why TriLift? First of all, I wanted to partner with someone that I knew had looked at muscle stimulation for a long period of time, and safety and efficacy was really, really key. And so partnering with Lumenis was a really important aspect to me. I knew that I wanted to bring in a form of skin firming and also muscle stimulation, but because I have a very long-standing and also loyal clientele, I wasn't just going to look at any device, and I really did a lot of research into the devices on the market and also what they could achieve. And so my return on investment was really important in looking at, well, how can I use it with other devices and what different types of technologies did TriLift offer that I could expand into the services, and that was one of the key aspects for me. One of the most important aspects was obviously safety and also efficacy. And I really felt that with the clinical data and talking to TriLift and really understanding the machine, that I felt it had the safety and efficacy that I was willing to invest in and also do on my clients as well. Because for me, I am a business owner, but I'm also a working practitioner. So it was really important that I could see the results for my clients, but their safety was number one also. And because of the TriLift with the 3 different stages, from the dynamic muscle stimulation to the RF technology to also the skin needling, I could really customize the treatments for my clients from different skin types and also different skin tones as well. One of the aspects I love about the TriLift was the clinical validation and also the white papers on the TriLift. I still refer to this today through our education and also our training, and there's some really great papers on dynamic muscle stimulation, how it works, what it brings to the skin in form of skin rejuvenation. The tripolar has great clinical data as well, as does the needling, and I'll explain this to you as we go through the presentation. So where do we start when we have a look at facial aging? And in my clinic, because we don't use injectable, or we have very few clients having injectables, I really wanted to focus on what actually occurs within the skin and what happens when the face starts to age. And aging isn't just about the skin, it really goes much deeper than that. And when we have a look at facial aging starts from the bone. And one of the aspects that I think is really important to make your clients understand is that from the age of 35, we're starting to see a reduction in the skeletal bone, and that has an effect on the muscles, it has an effect on the fat layer, it also has an effect on the skin as well. So after the age of 35, you start losing about 1 millimeter of your skeletal bone every 7 to 10 years. And so that creates a flattening of the cheekbone and also the mandibular bone as well. We see the jowl starting to form within the skin and also nasal labial folds as well. But not only are we seeing a change in the bone, but you also see a change in the muscles. And that's where the area of the dynamic muscle stimulation comes in, particularly for women that are perimenopausal, which can be anywhere from the age of 40 up to menopause, which is approximately 50. You're really starting to see the muscles change because you lose about 20% of your muscle density, which isn't just in your body, but it's also in your face as well. And for women around that age, and particularly I think because we are seeing a lot more women working longer and having larger careers, is that facial aging and also the change is very, very confronting. And so to be able to offer a treatment that has muscle stimulation and work on the tone and texture of the skin was really key. And that was one of the things that I actually looked for. So TriLift is one of the best solutions to the muscles. And one of the reasons is that when we have a look at how the face ages, the muscles can do 2 different things. So first of all, we see a resulting in drooping and also sagging of the skin, particularly in the cheek area, where some of the muscles around the chin and also the forehead actually shorten. So when we use dynamic muscle stimulation, we can target the different muscles of the face. And that was one of the key areas that I was really focused on, was using dynamic muscle stimulation to look at the different areas of toning. So with the dynamic muscle stimulation, also known as DMST, this works so well for stimulating the muscles, causing them to expand and also contract. So like going to the gym for your face to actually strengthen the muscles within your skin and also to target lifting and also contouring of the face. One of the areas that I loved about the dynamic muscle stimulation is that we could target individual muscles And so for clients that maybe have larger jawline, we could really look at firming within underneath the cheek area. We could concentrate on the eye area as well. So we had some of our clients that would come in to the clinic and say, I'm really concerned about my eye area. And the dynamic muscle stimulation allowed us to focus just around the eyes. Or for clients that have certain areas of the face, we could really target those individual muscles. And that's what I absolutely loved about the dynamic muscle stimulation. One of the key areas about the dynamic muscle stimulation is that it also helps to stimulate your capillary activity and really help to feed and also nourish the skin. So why I love the TriLift is because it's 3 modalities in the one treatment. So it allows you to really customize the treatment for the clients. And with the customization of the treatment, I could really then focus around exactly what their needs were. And whether that is eye area, as I mentioned before, or the cheek area, I could really then focus in on this. And I'm going to show you in just a minute a slide that actually targets the muscles themselves. So what they're applying to the skin is a glycerin. The glycerin gives a really great slip and glide. And you can see the pulsating movements and the electrical stimulation of the dynamic muscle stimulation. This particular treatment is fairly comfortable for the clients. I actually don't like it if they talk during the treatment. So you can see the different hand pieces allow us to work in the different areas. This particular hand piece is really great around the eye area. We've seen a real noticeable lift around the eyes and even into the forehead. Even though you don't use it on the forehead, it really does help to lift around the eyes from the forehead area as well. And so for the clients that are using it in conjunction with injectables, what we've found is that they need less Botox in their forehead area, and that's worked really, really nicely. So what are some other areas of the TriLift that actually makes it so unique, and why my favorite treatment would have to be the tripolar radio frequency energy that you actually use in conjunction with the dynamic muscle stimulation, but it can also be used on its own. And where we're starting to use this in the clinic now, particularly during winter, is for dry skins. It gives a really beautiful aspect with the radio frequency to a dry skin to help increase the hyaluronic acid production within the skin. And we really have seen a noticeable difference with that as well. So the radio frequency energy, you can use all over the face, and it's also a great treatment to use on the neck as well. So I find that particularly for clients that are actually losing that little bit of elasticity on the neck area or want that little bit of skin smoothing, it works beautifully for them. The third part of the TriLift is the radio frequency microneedling. This you would use as the third part of the treatment itself, and I'll let you watch some of the video with the penetration. So it's not only skin needling, but skin needling with radio frequency. I have used a number of different devices with radio frequency in the clinic, and also pen needling as well. And this hands down gives the best results for the skin. We use it as a standalone treatment within the clinic, and we also combined it with the TriLift as well. And with the needling really does allow that beautiful rejuvenation on the surface of the skin for texture, for pores, for luminosity, and if there's one part of the TriLift treatment that really makes a difference, it's actually the micro skin needling. I'll also explain to you in the coming slides how we use it separately, because I think this is one of the best needling devices that I've ever used. I've had a client that's just finished a course of treatments, needling only, so she hasn't done the full TriLift treatment, and she's had other ablative treatments done in the past, and she can't believe the difference in her skin. And she said to me, just on Friday, actually, she said, the results are everything that I wanted to achieve with my skin. And I think that's actually pretty special. So how does TriLift as a treatment, how do you actually have the protocol? So what is it? We recommend 6 treatments within the clinic. The majority of the treatment of the clients that actually come into the clinic for TriLift, I would say a 45 plus. I've also treated a 75-year-old lady who had a facelift in the past, and she couldn't have another facelift. So the TriLift worked beautifully in maintaining the results that she had, but we really do find that you need to do 6 treatments. We have done 4 treatments on someone in their 30s, but 6, I think, gives a much better much better result, and I'll explain why in just a moment. The best outcomes for TriLift are every 1 to 2 weeks, and that's really dependent upon how often the client can actually come in. And from there, we recommend a maintenance session every 3 to 4 months. We do customize this for the client, and I think it's really important depending on what the client wants to achieve. So as a non-injectables clinic, this is the only form of stimulation that the client is actually getting. So if they really want to focus on their skin and also the firmness of their skin and also the texture, I think every 3 months is really, really important. So let me explain the treatment plan and also protocol. So as I said, 6 treatments. Treatment 1, we use the dynamic muscle stimulation. We also use the tripolar energy as well. And then to finish that off, we use the skin needling. So that's 3 treatments in one, and that way we're treating the muscle aspect, we're treating the skin with the radio frequency energy, and then we're also treating the surface of the skin with the micro skin needling. Treatment 2, which they would come back for in either 2 or 3 weeks, uses the dynamic muscle stimulation and also the tripolar energy. And what we do in the clinic is we pair this together with a peel. We find that if there's any microcrusting on the skin from the first treatment, that it lifts off that microcrusting really, really well. And then we finalize that with an LED light. So treatment 2 gives the skin a really beautiful, luminous glow, and we find that the clients then can really start to see that rejuvenation happen after treatment 2 on their skin. Treatment 3 is a repeat of treatment 1. So again, they have dynamic muscle stimulation. They also have the radio frequency energy, and then it finishes off with the micro skin needling. Treatment 4 is the mirror image to treatment 2, as is treatment 6. So treatment 1, treatment 3, and treatment 5 have the 3 different stages, which is dynamic muscle stimulation, radio frequency energy, and then the micro skin needling, combining all 3 treatments in the one service. Then treatment 2, treatment 4, and treatment 6 are dynamic muscle stimulation, radio frequency energy. As I said, we also pair this together with a very light lactic or enzymatic peel, and then an LED light, so their skin looks really, really beautiful. And the fact that there's no downtime on treatment 2, treatment 4, and treatment 6 means that the clients are really happy because they can plan their weekends and what they're actually going to do. In saying that, the downtime from the skin needling on treatment 1, treatment 3, and treatment 5 is very, very minimal. You may get a little bit of redness, a little bit of erythema. We actually get our clients to take a antihistamine, and it reduces any histamine within the skin. So there's very, very little downtime or redness after the needling on the skin. One of the aspects that I love the most about the TriLift is combining it with different treatments. So this particular device having the 3 different therapies, dynamic muscle stimulation, radio frequency energy, and also the microskin needling, means that you can really expand out your treatment menu. And I didn't anticipate when I actually bought the machine how much we would be able to use it in the clinic and what we would be able to do with it. And of all of the devices that I've got within the clinic, this is the one device that I can use in so many different ways, and I'm going to actually share that with you. And I said we have one device with 7 treatment options. I just have increased that to 8 treatment options. I don't want to miss any of these aspects, so I've got some notes that I want to make sure that I actually go through with you. So the first menu option within the TriLift is the full treatment. So that's dynamic muscle stimulation, radio frequency energy, so the tripolar radio frequency energy, which is a lovely warming heat that works on the collagen, the elastin, and also wrinkle reduction as well. And then the third part of that treatment is obviously the skin needling, so which works on the overall surface of the skin. The second treatment option is using the dynamic muscle stimulation, the radio frequency energy, and then, as I said, we pair this together with a lactic peel and also an LED light. So therefore, it gives us another option with that. In fact, I actually had that option this morning in the clinic, and you can see that my skin's got no downtime to it. And it's really nice to be able to do a treatment that is not painful and to be able to go out that night. Our third treatment option is obviously the skin needling itself. And I was saying to the team at Lumenis today how much I actually love this treatment. And the reason that I love the needling is because in the past with needling, we've always needed to use a numbing gel to really get those great results. One of the aspects with the TriLift needling is that there's no numbing gel. So it's a quick, fast and effective treatment. We pair it together with an LED light at the end just to calm the redness from the skin, but it gives a very, very fast result. And I can do a full needling treatment, face, neck, and décolletage area in just over 20 minutes, and the results really are fantastic. It's quick. It is a little bit painful when you're doing it, but not too much. And it is over and done with so quickly that the client forgets about the pain once they're actually sitting under the LED light. But that would have to be one of my favorite treatment options. One of the other treatment options that we use or treatment number 4 and that we use in the wintertime is the radio frequency energy. So where we use the radio frequency energy as a treatment now is that for clients in the past that have had laser genesis done, or maybe they've actually had skin needling, they want to have a treatment where there's no downtime, it's not too painful, but they still get that really great collagen stimulation. That is where we use the radio frequency energy. I use it on the face and I also use it on the neck area as well. And that is a great treatment. So we also pair that together with a very light enzymatic peel and then also LED as well. So we're really creating those different options all the time. As one of our other very quick and fast treatments, which we call our mini treatment. So it's a mini TriLift treatment. We now use the dynamic muscle stimulation and the radio frequency just on the cheek area. So we can multi-use that within the clinic. And we also do a fast dynamic muscle stimulation and also laser genesis treatment as well. And that way we can get the firming of the dynamic muscle stimulation, but for the clients that love the laser genesis, we can pair that together. And we're always building out the different treatments for a couple of reasons, because we can expand the results that the clients are seeing within the clinic, but it means that we're consistently using the machine as well. And our return on investment is fantastic because we're always taking the client's treatments to the next level. By cross-servicing with other modalities, it does mean that the devices not sitting in the corner, and that the clients are seeing this lovely expansion of what we can actually do with their skin. And when you invest in any technologies, particularly expensive technologies, you want to make sure that you're utilizing them in as many ways as possible. I just want to check my notes to make sure I haven't actually forgotten anything about the services that we offer. No, I think that's it. One of the other great menu tips as well that we've found with the TriLift is that it's a really great treatment for someone that wants a very quick and fast result in a small amount of time. And we all have clients that come in that want great results, and they're like, well, I've got a special occasion in a couple of weeks. And one of the areas that the TriLift allows you to do is to be able to have a very effective treatment where you can bring change to a client's skin in a short amount of time without actually downtime. With the TriLift, it's really very easy to use, and also is very light. And having used heavy devices for the majority of my career, I find that the hand pieces are really easy to hold, particularly when you're holding them all the time. And one of the other areas is it's very easy to train your team on how to use the TriLift and to delegate the different areas, particularly with the needling, because anyone can do the skin needling on the surface of the skin. As I mentioned, it's great to progress treatment options. So for our clients that have been doing laser genesis or laser facials for a number of years, we've been able to transition them into the radio frequency energy treatments, and now into TriLift treatments, and then also into the different skin needling as well. So as a clinic where we have seen consistent clients over a number of years, in order for me to stay relevant to them, I've always had to change my services. And the number of treatment options that TriLift allows me to utilize means that I can do that all the time. We can do a number of months on one treatment, we can then progress to another treatment. So we've got those clients coming in consistently. And that was one of the areas that I loved about it as well, is that we have now set up programs where the client is either coming back monthly for maintenance treatments or bi-monthly, depending on what they want to achieve, or even yearly. And the flexibility of the device, and whether we choose muscle stimulation or whether we choose skin needling or whether we choose radio frequency energy, allows us to really customize it for the client's needs. So I would like to show you some of the results that we've achieved. As I said in the beginning of the presentation, one of the areas about my clinic is that we really are about skin health without the need for injectables. So creating that beautiful, luminous skin is really key in what we do, and we're very open with our clients about the results that they will achieve through the treatments. Remembering that we are seeing clients that are often 40, 45 plus, so their hormones are starting to change, their face is also starting to change as well. So as part of the consultation, the results that we explain to the clients that they will achieve have to be very, very realistic. We as a clinic are really proud of the results because it's all based around their own skin. This isn't about skin that has they haven't necessarily had surgery, or they haven't actually used injectables, because the majority of my clients don't. So this is one of our clients that came into the clinic. She is so happy with the treatments. In fact, one of the most noticeable differences that I think that you can see with her skin is the difference in texture, and this is really from the needling. She was very happy with the firmness within her face, but most importantly, the pores on her skin, she could really see a noticeable change with, and that was from the skin needling. This is a picture of one of our first clients that we did within the clinic. She'd actually had a BCC removed on one side of her face, down the nasal labial fold, which had really caused a drooping within her face. And using the TriLift, we were able to correct that, and she felt so much more comfortable with her own face and the way that she actually looked. And you can see with her skin how luminous her skin is, how the color is actually so much better as well. And that's one of the things that the TriLift treatments do, is they really bring a lovely glow and luminosity to the skin, and just this really beautiful skin health. This is probably one of the favorite results that we've achieved within the clinic. This particular client hadn't had any treatments within the past. She had come to us for a little bit of skincare, and I was really surprised that she wanted to do the TriLift treatments. She's now one of our best clients that come into the clinic, and you can see how much stronger and more resilient her skin is. So she uses clinical skincare that we have within the clinic, and also the TriLift treatments. So she did 6 treatments. She's since maintained that as a maintenance every 2 to 3 months as well. But if you have a look at around her cheek area, her vascular has reduced, her pore consistency is so much better. And she's a mature lady. She's in her 70s, and she didn't want the skin of a 20-year-old. She wanted to feel good in her own skin, and she wanted to feel good about the way that she looks. And yeah, I'm really, really proud of the results that we achieved for her. And that's what we're about. We're, you know, as clinicians, we're about creating beautiful skin so people actually feel really comfortable in their own skin. This particular client came in because she was concerned about her eye area. So we really focused around her eyes. You can actually see the lift underneath her eyes, but she really achieved a great jawline firmness, as you can see in her before and afters. And this particular client is also coming in for maintenance treatments as well, and she's super happy with what we've achieved. This particular client I've known for a really long time. So she's had multiple treatments within the clinics, predominantly skin needling. And the before photo, she'd already had RF needling in the past, and she'd also had pen needling. And for me as an operator, I was always really stuck with her skin because I actually couldn't take it further, and she doesn't want to have injectables. And introducing the TriLift into the clinic, you can actually see post 6 treatments the beautiful difference that it's actually made. And I actually saw her outside the clinic the other day, and she just looks absolutely fantastic and feels really good about herself and is really, really happy with the skin. So this is a photo of me when I first did TriLift. I wanted to trial it on my own face. Coming into my 50s, I was really starting to feel the aging process. I could see it in my face. It was really, really confronting. And my treatments were actually 4 treatments. I didn't actually finish the 6 by the time I'd had these photos taken, and that was 3 months in between. But you can see the lifting that I've achieved under my eyes, and also my jawline as well. So, and you can also see again the consistency of my skin, how much healthier and also stronger it looks. I'm just going to share with you some of our next slides as well. So as you can see on the slides, these are 3 months post the 4 treatments. But as I mentioned earlier, I do believe that 6 treatments is the most effective way of actually doing the treatments. And again, some long-term treatments as well. One of the other areas that I love about the TriLift, and particularly with the needling, is that because you get the combination of the dynamic muscle stimulation and then the collagen and elastin stimulation through the tripolar energy and then the smoothing of the skin through the needling, you can really start to see a difference in the consistency of the skin. And also great for sun damage, as you can see from some of these photos. One of the areas that I found surprising when I treated one of my clients was using TriLift post a facelift. And as I said, one of my clients, I don't actually have her photos up tonight, but I'll talk as we go through these photos, is that using the TriLift to maintain the results that she had post-TriLift, using the TriLift to maintain the results that she had post-surgery was really, really effective. And also around the eye area. So what are some of my key takeaways by introducing the TriLift into clinic? Because of the number of treatments that is involved doing TriLift, so generally about 6 treatments, you will become very, very busy. And it is a fantastic aspect to be so busy within the clinic when you're constantly doing the treatments. You've always got people actually coming in, and it's very, very easy to get this machine booked out. I think that the RF needling is one of the best needling devices that I have ever seen with the TriLift. And I was speaking to the team at Lumenis about how much I actually love this, because it is so customizable, it's very quick, it's very, very easy to use. And if you are thinking about introducing needling into clinic, I hands down have to say this is absolutely brilliant. And I have used another RF needling device before, and I've got pen needling, and I've got needling that also has a serum infusion, but this is what has actually really got us the best results with our client's skin. It's very adaptable, it's very light, and it's very easy to move from room to room, which is so important when you've got we've got a smaller 2-room clinic. But when you have a big clinic, you want to be able to move it with ease. It moves around the bed really easily. And as I said, the hand pieces are really light, so they're very ergonomic for your shoulders and your arms as an operator. Very easy to train your staff with as well. So I hope that you've enjoyed the presentation and also learning a little bit about TriLift. As a clinic owner, and also as a business owner and a practitioner as well, for me, the introduction of TriLift has been a game changer in my clinic. It's really allowed us to move from being able to offer just base rejuvenation to really anti-aging treatments that we can see a noticeable difference within our client's skin. And as I said, we're a non-injectables clinic, so to be able to offer a service where we're really bringing skin change was really, really key, and I couldn't recommend it highly enough.
Thanks so much for such an informative presentation, Sarah. We've really enjoyed it. And we've actually had a couple of questions that have come through, so we're going to jump straight into them. The first is, how long does it take to do the lower face and the eyes? So I'm assuming this may be in relation to the muscle stimulation predominantly.
So if you're just doing the muscle stimulation by itself, it takes about 20 minutes, but we take at least an hour to do a full treatment, because we do muscle stimulation, we do radio frequency energy, and then we also do the needling on top of that, and we then pair it together with an LED light. So all of those different sections take that time up within that. But if you're just doing muscle stimulation in itself, it's 8 minutes either side, and then I spend about 4 minutes each side for the eye area.
Great. And that does kind of answer the next question, but I'm sure you could probably elaborate a little bit further. So someone's asked, can you treat isolated areas? So could you just treat the eyes, or could you just treat a certain muscle group and avoid the rest, or not treat the rest?
Yeah, definitely. And that was exactly how we started with one of those with one of the before and afters that we showed, which was just treating around the eye. And then we wanted to progress onto the rest of the face. I think with TriLift, because the results are so good, you want to expand out your service offering. I didn't want to limit just treating one area because it also limits the amount that you're charging as well. So you really want to make sure that you're trying to give a full service treatment for the clients. What would your feedback on that be, Jess?
Yeah, look, I've had, I've trained quite a few of the clinics that have TriLift and obviously work very closely with a lot of our TriLift providers. And I agree with both sides. I think it's great to be able to spot treat, maybe to give a more intense result in a certain area. But I agree in the fact that it's best to treat holistically. A lot of the time, everything is supported together. So if we can aim to strengthen the whole mid-face and strengthen the surrounding muscles around a concern area, that can often provide better results than just focusing on that point. So I think it's nice to be able to isolate areas if you want to increase the results or enhance the results in that particular area, but it should be performed in conjunction with a full face treatment in most cases. I think the one time I would probably only treat isolated areas is if I had a very young patient and they said, I'm only concerned about my eyes. And I thought, yeah, you really don't have any other aging concerns, then that's when I would do that.
I agree with that as well, because if you've got a mature client and you're just treating the eye area, they're not going to see the wonderful results that TriLift brings just by treating the eyes.
Correct. Yeah. And usually, even if they do have concerns just around the eye area, give them another couple of years and everything else follows. So it's good to treat it early. Our next question is, can you perform TriLift without the needling, or are the results enhanced if you include the needling?
I'm going to say yes and yes. The results are enhanced with the needling, and the reason is that the radio frequency needling does two different things. It creates an additional heat underneath the skin, which causes collagen coagulation, plus as well as that, you've got this really lovely thickening of the dermal area. But most importantly, the needle works for the pore sizes and the overall luminosity of the skin. So I love TriLift with the needling because I think that the results are better, but the results are still great without the needling. I just prefer them with the needling because I think it's a more rounded effect. If you are going to do it without the needling, though, one of the aspects that you can do is weekly treatments, doing dynamic muscle stimulation and also the tripolar radio frequency energy, and that gives a really, really great result. And again, it builds your business by introducing it once a week over an 8-week period.
Great. I've also got a question actually that says, can you perform more than 6 treatments in a row? So maybe the client has more severe concerns, or they just have the budget to be able to do more treatments. Is there a limit to how many treatments you could perform in a row?
So with the needling, you can only do the needling every second treatment because obviously you want to leave around about 3 weeks in between the needling treatments, and that depends on the type of needling that you do. So there's a variety of different needles with the TriLift, whether you're choosing a 6mm needle or a 1mm needle. It also depends on the thickness of the skin. So some of our clients, we've been able to do another follow-up needling treatment 3 weeks later. Some we've actually had to stretch to 4 weeks. So it really just depends on the client. I've actually forgotten the question, Jess. Sorry.
It was more so if they could perform more than the standard 6 that you recommend.
More than the standard 6, yes. Yes, you can. And then, sorry, that's right. So then you can even do without the needling, and you can just do the dynamic muscle stimulation and also the radio frequency energy. I would then give the skin a break after 8. Would you agree with that, Jess?
Yeah, like it really depends on how they're handling the treatment, and I guess the you know, how good of a barrier they have. So if they've got a fairly strong skin barrier and they can handle having radio frequency and needling quite often, then I would say that, you know, if they've got the budget for it, they can continue to have as many treatments as they like. But I certainly don't suggest, you know, doing any less than the minimum.
No,
otherwise
I agree.
It will compromise their results.
Yeah, I 100% agree with that. So, and that's why we sell them as a package of 6 treatments. The only time I won't sell them as 6 is if I have someone that's 30 or younger wanting to have treatments, and then it's a minimum of 4 treatments. But we have found the maintenance treatments fabulous, and it's a really great way of having them come back into the clinic. If they don't want to have dynamic muscle stimulation every single time, then 1 month we offer the radio frequency energy either by itself or with the needling, or the following month you might pair the 3 together, which is dynamic muscle stimulation, the radio frequency energy, and then also the needling.
Great. There is a question that I might answer for you. So someone has asked, what is the difference between this RF needling and the other RF needling device that we offer? So we have a device called Legend Pro Plus, which looks quite similar, although it's white. When it comes to RF needling devices, generally speaking, when you have the newer versions, you're going to have the ability to have more control around the parameters of the RF that's penetrating into the skin while we're performing a needling treatment. So we actually have the option to have a longer pulse width, as we would call it, and a higher power or output from the RF needling on the TriLift in comparison to the previous device, which is Legend Pro Plus. So you have the option to give more enhanced treatment results. And one thing to note as well, I know the question was more so about RF needling, but our Legend Pro Plus device doesn't actually incorporate the dynamic muscle stimulation. So that device is purely radio frequency and radio frequency needling, whereas this has both of those plus muscle stimulation. And then we have had a question as well, Sarah. This is probably good for you because you've had quite a few customers that you've treated. So someone has asked if you have noticed any reduction in firmness. So I know a lot of the time, you know, people are talking about fat loss with certain technology. And personally, that's not something that I have had experience with TriLift. We don't tend to treat aggressively, but it would be good to hear your feedback on this as well.
Can you, I think can you just repeat the question for me?
Yeah, so it was, did we notice any adverse events such as reduction in firmness due to fat loss during the treatment course?
Yeah, no, absolutely not. If anything, we see the skin actually becoming better and better as time actually goes on. And I think that that's a combination of different things. So I think it's a combination of the muscle stimulation and the firmness of the muscle that actually starts in the initial part of the course, plus the tripolar stimulating the collagen and elastin production. As we know, that doesn't just stop stimulating when you stop your treatments, it actually keeps going, as does the needling, as does the effects and the benefits of the needling. So I think if anything, our clients' skins improve over time and we get better results with it.
Great. And I will probably add to that as well. I've, as I mentioned, I do see this topic talked about quite often online and just in the industry in general. And, you know, there has been some reports with some technology where this has occurred. I think what tends to happen is if someone is relying on one modality or one technology to hit the nail on the head across multiple concerns, and what tends to happen is the practitioner will crank the settings of a device and maybe treat beyond standard parameters and have adverse events like this. I think apart from the fact that we don't suggest that form of treatment and aggressive treatment, I think one thing that really helps with TriLift is that we're not just focusing on something like, you know, cranking up the settings on RF needling to get the results. We're relying on gentle radio frequency stimulation, you know, dynamic muscle stimulation and the RF needling to work together in unison to create that really beautiful firming result. So we don't need to just choose one technology and go really hard and fast on the settings and have adverse events as a result. So that's been a really great part of of the device, not having to rely on just one. And actually, another question.
Can I finish that,
yeah.
Jess? Sorry, I actually want to finish that question as a business owner. So that was one of the questions that I also had before I purchased the device. And one of the aspects that I loved the most about it was that Lumenis had already had this technology in place in a different form. So they already had the needling and the results of the needling with their other devices. So that safety and efficacy around the needling was really important to me. But the fact that this was a newer and updated device, it had better technology, it had better clinical data behind it, I knew straight away the safety and efficacy of the needling aspect, which I think is just so important to be aware of, because these are people's faces, and no one wants to create damage to someone's face.
Agreed. We've had another question that's come through. So someone has asked, what's the difference between Sarah's other RF needling and the TriLift? So I think you mentioned that you have quite a few needling options in the clinic at the moment.
Yeah, so we've got pen needling, which I think a lot of businesses have. The other needling device that I have is a I hope I can say it, is the Vivanci RF needling. And the Vivanci, up until the time I got TriLift, was fantastic. It created a little, it did create rejuvenation within the skin. It improved the pore texture, but I felt that I couldn't move further with the treatment results. And whilst we still use it, and it is a great technology, and we can also use it on darker skin types and also skin tones, it doesn't get the results that the TriLift microneedling does, and that's why this is our go-to and device of choice as well.
Great. I do remember us talking about that in quite a bit of detail when you were originally, looking at technology and seeing what you were going to settle on. So it's good to be able to, compare previous devices that you've used and, talk about the pros and cons of each.
And also, it's a really great step. So for clients that had already had good results with the Vivanci, we could show them we could get even better results with the TriLift.
Yeah, beautiful. And I actually, while we're on that point as well, Sarah is one of our TriLift providers who uses one of my favorite needling tips the most. So we do have quite a few arrays of needling tips while we're on that topic. So we have a few different lengths, a few different amounts of needles on the tips to customize the treatment outcome. But there is one tip that we offer, which is it offers a higher level of ablation, so it's got wider needles, very short. We call it the short fat tip because they're very, very tiny short needles, but they have double the width. And what this means is Sarah's used this quite a bit on some of her customers, especially in the before and afters that we've had. It creates really great shrinkage of the skin, so really great for enhancing results on someone who does have quite a bit of photo aging. So that's been a really good one to help with your results. There's also been another question that's come through.
Can I quickly answer that one, Jess, as well? So one of my team, who's also Sarah as well, so she's been using the that tip that Jess was just mentioning on one of our clients who has a very fine skin. So she did a full course of TriLift, used the needling chips, and then finished the end of the treatment with what's called the 7x7. And we both, my other team member Sarah and I were, she came up really, really red post-treatment, but the results of her skin are amazing. And that's what we're about, is that beautiful, strong skin health.
Beautiful. And we've got another question that's come through. We'll probably make this one the final question so that we finish on time. So someone has asked, are you often increasing your RF needling settings, or do you do multiple passes to up the intensity with each session?
That's a really good question. It depends on the client and also how many treatments that they've actually done. One of the benefits of the TriLift is that you can purchase different size tips. So one is about 0.6 of a millimeter, one's 1 millimeter, and then the 7x7 that we were just speaking about as well. So we tend to start on the most comfortable tip for the client, and then as they progress through the course of treatments, we increase the needle depth depending on what we're trying to achieve, and we also increase the settings. So we start a little bit lower, and then we never continue on that same setting. So we're always gently increasing it in increments, again, depending on what they want to achieve.
Beautiful. Well, thank you so much, Sarah. We've gone through quite a few questions, but we'll probably wrap it up now, again, just so that we finish in time. And I wanted to thank everyone for joining the webinar this evening. If you did have any further questions, you're more than welcome to email them through to us, and we will get back to you to answer those. But I will now close out the webinar. Thank you for joining.
Thanks everyone for joining us. I hope that you've enjoyed it. And you can also contact me personally as well and ask me any questions.
Great. Thank you, Sarah.
Thanks, Jess.
Thanks. Bye.